Hello, I am Dr. Daniel Mitchell.
My name is Dr. Thuy.
I'm Edouard Sabourdy.
My name is Minh.
Hello everybody, I'm Austin Wires with Central Vietnam Realty. Today we have a video that's not really about real estate. We are covering a topic that you all asked about and is more about Danang in general. And that topic is healthcare. We've had a lot of people inquire about the different healthcare facilities and services provided in Danang. As you may know, I am not a healthcare professional, so we're going to take you to a few of these hospitals, clinics, and things. We'll meet with a few industry leaders and experts in their fields and put forward the questions that you guys have been asking. Let's go check them out.
Hello, I am Dr. Daniel Mitchell. I'm a family doctor from the United States. I'm excited to share a bit with you about Family Hospital and all we can do here in Vietnam.
So could you introduce a little bit about yourself, about Family Hospital, and about family medicine in particular?
Sure, thank you for asking. As you know, I am Daniel Mitchell. I am a medical doctor from the United States. I did all of my training, including medical school and residency or postgraduate training in family medicine in the US. Since 2014, my wife and I have lived in Vietnam. I practiced for 1 year in Hanoi, and then at the beginning of 2016, we moved to Danang, and I've been employed by Family Hospital since that time. I am a family doctor. Just a word about family medicine. A good way to think of family doctor or family medicine, they are the same thing, is a modern generalist. Family doctors are like old general doctors, except we have 3 additional years of postgraduate training, so we can do more things. We are more up to date. Family medicine has a big need in Vietnam, and I am here to help provide that.
And what specialized departments or treatments does Family Hospital have that are maybe unique to Danang or to Vietnam in general?
I think in general, Family Hospital is much like a general hospital would function in the United States or other developed countries. We have an emergency department that's open 24/7. People can call 115 for a rescue squad to be brought to the emergency room, or they can come on their own. Otherwise, we have inpatient departments, we have outpatient departments. Like most other general hospitals, we have surgical department, we have a medical department with a number of medical subspecialties like cardiology, dermatology, rheumatology, most of the other subspecialties that you would find in the US or other countries, we also have here.
Beautiful.
Beyond that, we also have a very busy obstetrics department with lots of babies. We have a pediatrics department. We have a cosmetology department for those who might want plastic surgery. We also have an IVF, in vitro fertilization department for those who need help with fertility.
One-stop shop, it sounds like.
We can do a lot.
That's wonderful. That's wonderful. And for people who are looking to schedule an appointment, right? What is the typical procedure that goes into getting an appointment here at Family Hospital, and what would the wait times look like?
There is a phone number that I think will be provided that gives them a phone number directed to the international department where they can talk with someone and make an appointment. Wait times, typically people call them on an appointment, they're given a same-day appointment. We see them, many tests that we do, we can do the same day. Often we have the test results in 1 or 2 hours. So it is very efficient system, and by US standards is also very, very affordable. Otherwise, people can often just walk in as well. The international outpatient department, it functions much like a walk-in clinic in the US. You do not need an appointment, you can just walk in. I am routinely here 3 days a week, 8 a.m. to 4 p.m., and happy to see anyone who comes here. So besides myself, the other physicians are Vietnamese. Some of them have had additional training outside of Vietnam and other countries. Some of them have good English, some are a bit more challenged with English, but we have translators to use as needed that can translate to English, Korean, Chinese, Japanese.
Right. So how does your hospital, or how does Family Hospital rather, collaborate with other healthcare facilities and other professionals in Vietnam and outside of Vietnam?
We are a private independent hospital. As say, we function independently, but if there are problems medically that we cannot take care of, such as something that needs neurosurgery or thoracic surgery, then we offer transfer to Danang General or another facility that can do what we cannot. We also have a partnership with BNH in Bangkok, British Nursing Hospital, and if patients need or want to be transferred there, we can help coordinate and make it smoother for them to get there for additional care.
So with so much experience working in the healthcare industry, what kind of advice would you have for people who are looking to relocate to Vietnam in terms of healthcare or insurance?
So yeah, good question, and I will be very honest. If you just look at all of the advertisements about talking to Vietnam, they're in general very correct. It's a very safe place, the food is good, the people are very friendly, it is very affordable. But historically, one of the things that's been a challenge in Vietnam is the availability of good healthcare. Vietnam has come a long ways in the last 10 to 15 years. Healthcare is much better than it was, but it still has a ways to go. And that's why we offer transfers if needed to other facilities. My biggest advice for people buying insurance and moving to Vietnam, if it is at all affordable, it's good to get a policy that will transfer you or evacuate you from Vietnam to another country like Bangkok or Singapore for major problems.
Yeah, wonderful. Are there any government funded or subsidized programs for foreigners looking for healthcare services in Vietnam?
I'm not aware of any government kind of program for foreigners. Those are available for Vietnamese who have need. Beyond that, though, Family Hospital participates with several different Vietnamese insurance programs. There are also a lot of international insurance programs that we participate with.
Wonderful, wonderful. And just last question, you kind of touched on it. How would you compare the quality of services in terms of healthcare in Vietnam versus other countries like, let's say, America, Thailand, you mentioned Singapore, or even other countries in the area like Laos or Cambodia?
That is a bit difficult because I don't have a lot of experiences outside of the U.S. and Vietnam. I've not lived in the U.S. for 10 years. But again, medical care in Vietnam is improving rapidly. Vietnam likes technology. Like I mentioned, we have in vitro fertilization, we have an MRI machine. Vietnam, especially Family Hospital, is very conscious of keeping up with technology. I think especially the CEO at Family Hospital wants people that are caring and competent and wants to treat people like we want to be treated. So we all try to do our best to take care of the patient.
Hi everyone, good morning. My name is Dr. Thuy and I work at the rehabilitation department in 199 Hospital. We are a public hospital. We're located in Danang, specifically on the beach side, Sơn Trà district, and we're very happy about that.
Thank you for that. Very nice to meet you, Ms. Thuy. Maybe you can tell us a little bit about how accessible is healthcare in Danang for foreigners, in your opinion?
Okay, so in my opinion only, I would say about 5 years ago, most of the services are coming from private hospital in Danang. However, I would say in the pandemic and after the pandemic, things change. So public hospital now are also already in the market pretty kind of strongly. For example, in my hospital, we see the rise of our patient number significantly within the last 2 years. Yeah.
And I would say mainly because that the private hospitals have an international ward, but maybe charge more than some of the local hospitals for similar levels of care. Would you say that's accurate?
Honestly, I think in the public hospital, we do get funding from the government. So it brings down the cost significantly. And also in the public hospital, we got a lot of really good doctors coming from reputable medical schools. And also we learn how to do customer service better also. So three of that factors making going to public hospital to have your health check much more relaxed and enjoyable.
Wonderful, wonderful. So can you briefly describe some of the facilities available here at 199 Hospital?
In 199 Hospital, again, we're very lucky to have the government's funding. So we actually have a lot of modern medical equipment, such as like we have 2 CT scans machine, 250 scanner, and we have like a 3D mammography machine. We also have like a machine to do endoscopy to detect cancer early. We have a lot of machine that is top notch, even in the world, to do rehabilitation for patients.
In this hospital or in Danang in general, do you think there are any language considerations foreigners need to think about when going to a hospital?
A lot of the hospital now, they are aware of the need of health care for foreigners, so they would intentionally hire medical healthcare staff who can speak English. Myself as an example. So I would say if you are coming from English-speaking country, or you know how to speak English, it's quite easy to access. Other than that, in my hospital, we also have like medical translation, interpretation available in Korean, and we have like a very cool interpretation machine where regardless where you're coming from, we have the machine to support your conversation with your doctor.
So regarding insurances, right? Maybe you can tell us a little bit, or the viewers a little bit about the insurance. I understand that you can have public and private insurance. Maybe you can just quickly touch on both.
Okay, sure. So this one will be the one that most of people feel like very confused about it. So I would like to, like you said, divide it into 2. The public and the private. So in Vietnam, we do provide Vietnam social insurance system. However, it's not available to all tourists. Like if you're a foreigner, you can still buy it, but you have to work for a company, and your company is a legal company that pays taxes to Vietnamese government. In this case, like for example, like Austin, he has one himself, right? He's been doing all of his taxes. On this card, there will be a line mentioned about the registered health facility on the card. And if you go to this hospital that is written on your insurance card, if you are inpatient or outpatient, the insurance will still cover 80% of all of your hospital fee. However, if you decide to go to another hospital, even that hospital is in Danang, not on your insurance card, then your fee won't be covered if you are outpatient. If you are inpatient, that means you got admitted to the hospital doing something like surgery, then the Vietnamese social insurance will pay 80% for hospital fee. I hope that is
I think it's very clear. And I know there are a lot of private options as well. Maybe you can touch on how your hospital handles the different private insurance plans.
There are a lot of options out there for you to choose from. I would like to mention some, like for example, Bảo Việt or InSmart or like Daiichi Life. There are many more. So for example, my hospital, we have a department that we allocate to deal with these with insurance claim. When the patient comes to my hospital, they will give us a private insurance card. We are going to contact the insurance and to understand about the right of the patient. And your right depends on your contract that you sign with them, depend on the money that you pay, of course. And we are going to do all of the paper on behalf of the patient.
That's fantastic. Yes. So you make it very easy, what I understand, right?
Yes.
The actual patient doesn't need to worry about dealing with their insurance company.
Correct.
In a time of already hardship, right?
Hi everybody, I'm Edouard Sabourdy. I'm a French chiropractor, a second generation chiropractor. I was trained in Paris. I arrived in Vietnam in 2011 and I worked for ACC since the beginning. I was the second chiropractor to get a license in Vietnam.
Hello Edward, very nice to meet you.
Hi Austin, nice to meet you.
We are here today with Edward from ACC Chiropractic. So maybe you can tell the listeners a little bit about what are some of the common issues or conditions you help with here at ACC.
So what a chiropractor takes care of is mostly all the problems that are related to the spine, the joint, the muscle, and the peripheral nervous system. Most of the problem for which the patient are consulting here is discal radiculopathy. So it's basically a disc problem that is pinching on the nerve.
Right.
And what we see in Danang with the population that is coming to our clinic are mostly chronic problem and people who want to avoid the surgery for disc issue.
Right.
But we are also treating problem related to other joints, and we see a lot of people who have flat feet for which we are doing orthotic, and knee problems that can be related to their flat feet or trauma.
The whole shoot and match, but it sounds like most of the clients are regular repeating clients, is that correct?
Right now, because we've been open for over 4 years, we have a lot of regular patients that come for management
Right.
like they don't have pain, but they come regularly to make sure that no pain occurs.
Preventative,
But we
right?
still have a lot of patients that come in pain with chronic pain or acute pain.
Can you compare a little bit about, let's say, the chiropractic treatment you would get here versus maybe in France or in America? Is it similar or different in any ways?
The chance that we have in Vietnam is that we are able to have more equipment. In France, most of the chiropractors, they are just working by themselves.
Right.
Here it's a multidisciplinary clinic, so we can combine the rehabilitation, the passive physiotherapy, and the chiropractic. What I see is that we have really good result by combining every of these therapies for long-term improvement.
Do you have any advice for the people thinking about moving to Danang or residing in Danang already in terms of preventative ideas to help themselves with their spinal care so they don't need chiropractic care in the future?
So what we see for people who come, like the population of expat and tourists, traveling and changing country is a lot of stress. You have nutritional changes, you can have a different mattress at home, a lot of time it's a bit confusing, you don't go to the gym anymore. So a lot of these habits that you lose make you more likely to develop pain. What I would say is try to organize yourself as soon as possible. First, to keep a workout regularly. Assess your mattress, your working position to make sure that it's ergonomic. Okay? And in terms of nutrition, maybe you can transition slowly to a Vietnamese diet instead of all of a sudden, and make sure that you are not eating too much fried food, which can increase the chances of getting inflammation.
Right. Well, sounds like you're talking, I am an American, right? And the fried food and transitioning diet, Vietnam is so much better for that. So I agree.
Vietnamese food is quite healthy. Depending on what you take, but if you are not used to it, you can also have a little bit of disagreement in the beginning.
Right, right. Understood. Are there any misconceptions in general about chiropractic care or health care in Danang or in Vietnam that you would like to address or maybe cure the misconception?
So chiropractic is quite recent in Vietnam, since actually ICC was the first to open in 2016. And we can see that it's been really popular, and now even on social media, in Vietnamese social media, everybody's a chiropractor, from the hairdresser to the medical trainer and everything. And they think that all there is to chiropractic is cracking a bone, make a lot of noise, and then they're happy. Actually, chiropractic is something that is not only concerned with adjusting the bone, so the crack that everybody think about, but it's a complete therapy. And a lot of people who pretend to be chiropractors, they just try, see something on YouTube and try to do the same. It can be okay, but a lot of time it can be also dangerous. So the misconception is that the name chiropractic is often taken for granted when it's only people who are trained in chiropractic schools that should be able to do it.
And I agree 100%. Always best to find true professional help like yourself. So you've heard it here first. ACC available for everyone who needs chiropractic care in Danang.
Welcome to this Dental. My name is Minh, Director of the East Midwest Dental and also TGM Dental Clinics in Huong and Danang. I work for the East Midwest Dental since 2005, but it was established by Dr. Charles Kraft, American public dentist in the US since March 1996. And TGM Dental is a spin-off of the East Midwest Dental that we established in 2016. It's been 20 years after East Midwest Dental. And first of all, we opened in Huong, and then later on, we opened in another one in Danang. And now, currently, the East Midwest Dental is in Central District.
3 locations across Danang and Hotline. It's really wonderful. Growing quickly, I would say.
Yeah. Our mission is to bring back the healthy smiles to the disadvantaged children in Vietnam. We want our revenues from the East Midwest Dental and also TGM Dental to help maintain the charity programs that we established a long time ago, almost 30 years now.
What dental service does East Midwest and TGM provide for both Vietnamese and international clients?
We have been able to provide wide range of full dental care to Vietnamese people or foreigners. Basic levels like teeth cleaning, checkup, preventative sealants, and restorative fillings, extractions, all types, up to cosmetics or high-end techs like braces or implants, from the little kids up to advanced clients.
Fantastic. Sounds like you handle everything. So what are some of the most common procedures that foreigners seek when getting dental care at East Midwest?
The majority of foreign clients, if they are staying in Danang or Huong, is a regular checkup, 6-month cleaning, whitening. But the foreigners from outside the country, they often look for restorative dental care like fillings, crowns, and also veneers. Yeah, and also they have a lot of problems with missing teeth. Another reason is they want to replace the old fillings with amalgam. In amalgam, have with mercury is the reason to make us easy to get cancer. And mercury is not good for environments, for cold health workers, so it's not good. So the majority of our clients, over 90% of them, want to replace all the old filling with amalgams. And the price is quite cheap in our clinics, just about 300,000 Vietnam dong for removing and filling with a composite or full porcelain with the inlay, overlay techniques, very friendly to the environment and also to clients.
What are some of the average costs for dental procedures here at East Midwest?
Yeah, we have the same behavior to foreign clients and Vietnamese. For example, teeth cleaning is just between 150,000 dong up to 200, or maximum for deep cleaning maybe 300,000 dong. That's it.
Not more than $12 US. Very, very affordable.
Yes.
What about for some other procedures, like maybe fillings or extractions?
For the fillings, like the restorative fillings, and between 180,000 dong, 250,000, 400,000 dong, maximum is 550,000 dong for composite fillings. Yeah, and in case and if they have a broken tooth, chipped, they need with the porcelain overlay techniques, is a cost 4.7 million dong for that crown.
Still only $200 for a crown. Compared to the US, it's peanuts.
Yeah,
it's very, very
most of our clients said that they save significantly their cost because 5-7 times in their home country have to pay for. Yeah, and also, for example, extraction. For the normal extraction is between 400, 600, 900,000 dong. For wisdom teeth, The upper might be 900 up to 1 million or 1.5 million maximum. For the lower, the one is really complicated. They cut them and pick it up, and it's just about 2.3 million.
Still less than $100.
Yeah.
It's very, very affordable.
$1,000 US
In the US, yeah. Better to come to East West, I think, for sure.
East Meets West dental or TTM dental stay in price.
So what are some of the main reasons you think that foreigners choose to come to TGM or East Meets West Day?
I often also wondering and ask them, why do you pick up our clinics? And they said, oh, it's very easy. First, because you do for the sake of children. And your purpose here is Mr. TGM Dentals. Your revenue should be funded back to the communities for the little kids. The second reason is quality. From the first step they come in, how we respond, how we communicate with them. The quality here is understanding English or any kind of language. Not always because we are from the American standard industry and we just be paid with the American. No, all will be the same with Canada, UK, or all of them all around the world. They feel that they are well behaved with the language communications. And the third reason why, because we don't have any discrimination in price. Same price with Vietnamese or foreigners or Asian people or Western people, same. So they save significantly their budget.
Yeah.
And the fourth reason is that we maintain and keep in touch with them, and we have the records in our clinic for the system. So anytime they need any records and keep tracks, we can let them know easily. Another reason is quite interesting because in somehow they have insurance. They ask us, hey, you do dental care, but I want to ask a favor to do the transparent documents for their insurance claim. Of course, we do for them.
Hello, my name is Jenny, and this is my husband Alan. We're from New Zealand, and on the recommendation of a friend there, we've come to Vietnam to TGM Dental to have our dental work done. The cost in New Zealand is astronomical, and the care here has been really wonderful. The staff and the dental assistants and dentists have been amazing, and we've been really, really happy with the care that we've had here and with our brand new team. And we would recommend others to come here and have their work done as well.
Wow, what a wealth of information. I hope you guys found that as helpful as I did. If you want us to connect you with any of the people in the video, just send us a message. We'll pass on their information. If there are any other topics you'd like us to cover in future videos, please do let us know. If there are any questions regarding real estate, property, the laws, procedures, anything, of course, let us know. We're always happy to help. And we look forward to seeing you on our next video. Thank you and have a wonderful day.